1. What is the priority nursing action before administering digoxin to a patient with heart failure? Answer. Check the patient's apical pulse for 1 minute. Rationale. Digoxin, a cardiac glycoside, slows heart rate and increases contractility. Checking the apical pulse for a full minute is critical to assess for bradycardia, heart rate less than 60 bpm, as administering digoxin in bradycardia can worsen cardiac function. This action ensures patient safety and prevents toxicity. 2. What laboratory value should a nurse monitor for a patient receiving heparin therapy? Answer. Activated partial thromboplastin time, APTT. Rationale. Heparin, an anticoagulant, is monitored using APTT to ensure therapeutic anticoagulation, typically 1.5 to 2.5 times control value. Monitoring APTT prevents bleeding or clotting complications, ensuring safe and effective therapy. 3. What is the antidote for an opioid overdose in a patient receiving morphine? Answer. Naloxone. Rationale. Naloxone, an opioid antagonist, reverses life-threatening opioid effects like respiratory depression by competitively binding opioid receptors. Prompt administration is critical in overdose to restore breathing and prevent death. 4. What instruction should a nurse provide to a patient prescribed levothyroxine for hypothyroidism? Answer. Take the medication on an empty stomach. Rationale. Levothyroxine, a thyroid hormone replacement, is best absorbed when taken 30 to 60 minutes before breakfast on an empty stomach. Food, especially calcium-rich or high-fiber foods, can decrease absorption, reducing efficacy. 5. What electrolyte imbalance should a nurse monitor for in a patient taking furosemide? Answer. Hypokalemia. Rationale. Furosemide, a loop diuretic, increases potassium excretion in urine, leading to hypokalemia. Low potassium levels can cause arrhythmias or muscle weakness, requiring close monitoring to ensure patient safety. 6. What is the priority nursing action when administering vancomycin 4 to a patient? Answer. Infuse the medication over at least 60 minutes. Rationale. Vancomycin, an antibiotic, must be infused slowly, over at least 60 minutes, to prevent red man syndrome, a histamine-related reaction causing flushing and rash. Slow infusion ensures safe administration and minimizes adverse effects. 7. What dietary instruction should a nurse provide to a patient prescribed warfarin? Answer. Maintain consistent intake of vitamin K-rich foods. Rationale. Warfarin, an anticoagulant, inhibits vitamin K-dependent clotting factors. Consistent intake of vitamin K-rich foods, e.g. green leafy vegetables, prevents fluctuations in INR, ensuring stable anticoagulation and reducing bleeding or clotting risks. 8. What is the onset of action for insulin lispro in a patient with diabetes? Answer. 5 to 15 minutes. Rationale. Insulin lispro, a rapid-acting insulin, has an onset of 5 to 15 minutes, making it ideal for controlling postprandial glucose spikes. Understanding its rapid onset guides timing of administration with meals to prevent hypoglycemia or hyperglycemia. 9. What adverse effect of gentamicin requires immediate reporting by a nurse? Answer. Hearing loss. Rationale. Gentamicin, an aminoglycoside, is ototoxic, and hearing loss may indicate irreversible toxicity. Immediate reporting allows for discontinuation or dose adjustment to prevent further damage, prioritizing patient safety. 10. What is the priority nursing action before administering enoxaparin to a patient? Answer. Verify the dose and injection site. Rationale. Enoxaparin, a low molecular weight heparin, requires verification of the correct dose and subcutaneous injection site, abdomen, 2 inches from umbilicus, to prevent errors and complications like hematoma. This ensures safe administration. 11. What patient education should a nurse provide for metformin use in type 2 diabetes? Answer. Take the medication with meals. Rationale. Metformin, a biguanide, should be taken with meals to reduce gastrointestinal side effects like nausea and diarrhea. This instruction enhances patient adherence and comfort while maintaining therapeutic efficacy. 12. What laboratory value should a nurse monitor for a patient receiving spironolactone? Answer: serum potassium. Rationale: spironolactone, a potassium-sparing diuretic, can cause hyperkalemia by reducing potassium excretion. Monitoring serum potassium prevents complications like arrhythmias, ensuring safe therapy. 13. What is the priority nursing action when a patient reports chest pain after taking nitroglycerin sublingually? Answer: instruct the patient to call emergency services if pain persists after 5 minutes. Rationale: persistent chest pain after 1 dose of nitroglycerin, taken every 5 minutes, up to 3 doses, may indicate a myocardial infarction. Instructing the patient to call 911 ensures timely intervention for a potentially life-threatening condition. 14. What side effect of phenytoin should a nurse teach a patient to report immediately? Answer: rash. Rationale: phenytoin, an anticonvulsant, can cause a rash that may progress to severe conditions like Stevens-Johnson syndrome. Immediate reporting allows for prompt evaluation and discontinuation to prevent life-threatening complications. 15. What is the therapeutic range for serum lithium levels in a patient with bipolar disorder? Answer: 0.6 to 1.2 milliequivalent/L. Rationale: lithium has a narrow therapeutic range, 0.6 to 1.2 milliequivalent/L, for efficacy in managing bipolar disorder while avoiding toxicity. Monitoring levels ensures therapeutic benefits and prevents adverse effects like tremors or renal damage. 16. What instruction should a nurse provide to a patient prescribed albuterol for asthma? Answer: hold breath for 10 seconds after inhaling. Rationale: holding the breath for 10 seconds after inhaling albuterol, a bronchodilator, allows the medication to reach deep into the lungs, maximizing bronchodilation and improving asthma symptom control. 17. What is the antidote for a heparin overdose? Answer: protamine sulfate. Rationale: protamine sulfate neutralizes heparin's anticoagulant effects by binding to it, reversing excessive anticoagulation and preventing bleeding. Prompt administration is critical in overdose scenarios. 18. What is the priority assessment for a patient receiving for potassium chloride? Answer: monitor urine output. Rationale: potassium chloride can cause hyperkalemia, especially in renal impairment. Monitoring urine output ensures adequate renal function to excrete excess potassium, preventing life-threatening arrhythmias. 19. What dietary restrictions should a nurse teach a patient prescribed phenelzyne? Answer: avoid tyramine-rich foods. Rationale: phenelzyne and MAOI inhibits monoamine oxidase, and tyramine-rich foods, e.g. aged cheese, cured meats, can cause a hypertensive crisis. This restriction prevents severe complications and ensures patient safety. 20. What laboratory tests should a nurse monitor for a patient taking simvastatin? Answer: liver function tests. Rationale: simvastatin, a statin, can cause hepatotoxicity. Monitoring liver function tests, e.g. AST, ALT, detects early liver damage, allowing for dose adjustment or discontinuation to prevent serious complications. 21. What is the priority nursing action when administering for morphine to a patient? Answer: monitor respiratory rate. Rationale: morphine, an opioid, can cause respiratory depression, a life-threatening side effect. Monitoring respiratory rate ensures early detection and intervention to maintain airway and breathing safety. 22. What instruction should a nurse provide to a patient prescribed prednisone for an autoimmune disorder? Answer: taper the doses directed. Rationale: prednisone, a corticosteroid, requires tapering to prevent adrenal suppression and withdrawal symptoms. Abrupt discontinuation can lead to adrenal crisis, making this instruction critical for patient safety. 23. What is the duration of action for insulin glargine in a patient with diabetes? Answer: 24 hours. Rationale: insulin glargine, a long-acting insulin, provides steady basal insulin coverage for approximately 24 hours. Understanding its duration guides administration timing and prevents overlapping doses or hypoglycemia. 24. What adverse effect of cisplatin requires immediate nursing intervention? Answer: nephrotoxicity. Rationale: cisplatin, a chemotherapy drug, is nephrotoxic, and signs like decreased urine output or elevated creatinine require immediate intervention to prevent kidney damage. Early action preserves renal function and patient safety. 25. What should a nurse calculate to ensure safe administration of medication dosed at 5 milligrams per kilogram for a 70 kilograms patient? Answer: 350 milligrams. Rationale: the dose is calculated as 5 milligrams per kilogram times 70 kilograms equals 350 milligrams. Accurate calculation ensures the patient receives the correct dose, preventing under- or overdosing and associated complications. 26. What instructions should a nurse provide to a patient prescribed doxycycline for a bacterial infection? Answer: avoid milk products. Rationale: doxycycline and tetracycline binds to calcium in milk products, reducing absorption and efficacy. Avoiding milk ensures therapeutic drug levels and effective treatment of the infection. 27. What is the priority nursing action before administering atenolol to a patient with hypertension? Answer: check the patient's heart rate. Rationale: atenolol, a beta blocker, can cause bradycardia. Checking the heart rate ensures it is above 60 BPM before administration, preventing exacerbation of low heart rate and ensuring patient safety. 28. What side effect of clozapine requires immediate nursing action? Answer: sore throat and fever. Rationale: sore throat and fever may indicate agranulocytosis, a life-threatening side effect of clozapine. Immediate reporting and action, e.g., stopping the drug, ordering a WBC count, are critical to prevent severe infection. 29. What laboratory value should a nurse monitor for a patient receiving methotrexate? Answer: liver function tests. Rationale: methotrexate, used for conditions like rheumatoid arthritis, is hepatotoxic. Monitoring liver function tests, e.g. AST, ALT, detects early liver damage, allowing for timely intervention to prevent serious complications. 30. What instructions should a nurse provide to a patient prescribed nitroglycerin transdermal patches? Answer: rotate sites and remove at night. Rationale: rotating patch sites prevent skin irritation, and removing the patch at night provide a nitrate-free interval to prevent tolerance, ensuring continued efficacy for angina management. 31. What adverse effect of rifampin should a nurse teach a patient with tuberculosis to expect? Answer: orange-colored urine. Rationale: rifampin causes harmless orange discoloration of urine and other bodily fluids. Educating the patient prevents alarm and promotes adherence, as this is an expected, non-harmful side effect. 32. What is the mechanism of action of omeprazole in a patient with GERD? Answer: inhibits acid production. Rationale: omeprazole, a proton pump inhibitor, blocks the H+/K+ ADPase pump in parietal cells, reducing gastric acid production. This mechanism relieves GERD symptoms and promotes esophageal healing. 33. What electrolyte imbalance increases the risk of digoxin toxicity in a patient? Answer: hypokalemia. Rationale: hypokalemia enhances digoxin's binding to cardiac cells, increasing toxicity risk, e.g. arrhythmias. Monitoring potassium levels and correcting imbalances are critical to prevent life-threatening complications. 34. What instructions should a nurse provide to a patient prescribed alendronate for osteoporosis? Answer: take on an empty stomach and remain upright for 30 minutes. Rationale: alendronate, a bisphosphonate, requires an empty stomach for absorption and upright positioning for 30 minutes to prevent esophageal irritation or ulceration, ensuring safe and effective use. 35. What is a priority nursing action when a patient on lithium reports tremors? Answer: check serum lithium levels. Rationale: tremors may indicate lithium toxicity, especially if levels exceed 1.2 milliequivalent/L. Checking serum levels guides further management, such as dose adjustment or discontinuation, to prevent severe toxicity. 36. What laboratory value should a nurse monitor for a patient receiving epoetin alpha? Answer: hematocrit. Rationale: epoetin alpha stimulates red blood cell production, and hematocrit is monitored to assess efficacy and prevent complications like hypertension from excessive erythropoiesis. 37. What interaction should a nurse monitor for in a patient taking warfarin and amiodarone? Answer: increased bleeding risk. Rationale: amiodarone inhibits warfarin metabolism, increasing INR and bleeding risk. Monitoring INR and observing for bleeding signs, e.g. bruising, are critical to ensure safe anticoagulation therapy. 38. What is the priority nursing action before administering 4-gentamicin? Answer: check peak and trough levels. Rationale: gentamicin, an aminoglycoside, requires monitoring of peak and trough levels to ensure therapeutic dosing and prevent toxicity, e.g. nephrotoxicity, ototoxicity, prioritizing patient safety. 39. What instructions should a nurse provide to a patient prescribed clopidogrel? Answer: report unusual bleeding. Rationale: clopidogrel, an antiplatelet, increases bleeding risk. Instructing the patient to report signs like excessive bruising or blood in urine/stool ensures early detection and management of bleeding complications. 40. What adverse effect of haloperidol requires immediate nursing intervention? Answer: fever and muscle rigidity. Rationale: fever and muscle rigidity may indicate neuroleptic malignant syndrome, a life-threatening side effect of haloperidol. Immediate intervention, such as stopping the drug and notifying the provider, is critical to prevent complications.